Welcome once again this beautiful Sunday afternoon at the Match Day Play Arena, New BL Road, Bengaluru. The TruAlt Bioenergy DH Cup 2023 quarterfinals are on, and I have with me here Dr C Swarnalatha. She is the head of the Department of Physiotherapy, PD Hinduja Sindhi Hospital, Bengaluru. Now we're going to ask her a few questions about fitness, about injuries, and how you take care of yourself. A very warm welcome to you once again this Sunday afternoon, Dr Swarnalatha, and thank you for being with us all along.
Thank you, sir.
Now the question I have for you, Doctor, is that through the tournament you have attended to so many of our players who've been down with either a sprain or a catch or a muscle pull. Why is it that a player suffers from a muscle pull or a catch suddenly right in the middle of the game?
So actually, in order to prevent all injuries, or especially sprain or any fall or any previous injuries or any history, clear history, they must to know the clear history, previous history of fall or traumatic stiffness, and they should maintain the flexibility, and they have to take rest, make sure that they are taking rest on rest intervals, and they are doing warm-ups or not, and they are not doing, if they are not doing cardiac outwards, cardiac workouts, and which is not really mandatory, sir, which is really mandatory for the improvised oxygen to pump the blood to the nerves, as well as it improves the blood oxygenation, and it improves the brain function also.
Okay, that's interesting. Now, Dr. Swarna, what kind of exercises, what kind of warm-up before a match like this on a hot afternoon would help in ensuring that your muscles are flexible and you don't suffer a pull or a catch?
First of all, they have to do warm-up, and during immediate fall, they have to take ice packs, and they have to keep the ice packs, and joint should be fixed on the surface, and they should not get panic, and they have to do they should not supposed to do any stretches in that moment. So therapist should assist in that moment, and it will be helpful. And further, any doubts or any assistance, they can call medical people like doctors, physicians, whoever it is.
Okay, now you spoke about cold packs. There is always a doubt in many people's mind. When do you use a hot water bottle to relieve pain, and when do you put an ice pack?
Actually, for any traumatic stiffness or any post-traumatic stiffness, we preferably will recommend to patients like hot packs. But only for the pain and any muscular spasms and overnight spasm nodules, eternity to the knots also sometimes. So in that cases, especially in bleeds like external or internal bleeds, ice packs are very useful, and that is the method of using therapy.
Now, there is a question, there's something which worries us all. It's something we, God forbid, it should never ever happen, but this is something which is always in the back of the minds of organizers of tournaments, as well, I'm sure, of coaches. Now, we've seen some very tragic instances in the past of players collapsing, very young, fit players collapsing in the middle of a tournament. What is it that causes these heart problems or arrests or infractions, and how do you ensure that it does not happen? In the sense, how should a player check himself to make sure that he is not at risk of such a incident while playing?
Actually, in order to prevent all cardiac output, cardiac vascular diseases or any heart conditions, and massive MI on field, like they have to do a regular warm-up and run-outs, like workouts with the treadmills, especially before playing. They should do flexible stretches because which is very helpful for their regular health, and they have to undergo regular health checkups before starting an activity.
Okay, one last question, Dr. Swarna. We won't keep you for long. I know the matches are on. But now people who are in high intense sports like football, hockey, basketball, how often should they undergo a master health checkup? And what are the parameters that should mandatorily be covered in a master health checkup?
Every year they must to undergo, every player especially, they must to undergo master health checkup, because which is very useful for all the functions of the body, functional activity of the body, I can say. Then we can rule out different parameters like LFT, RFT, and any other previous histories, any present medical history, whatever it is, any serious illness they have undergone earlier, that and all which can be ruled out with the master executive checkup. So we are exclusively providing the services from PD Hinduja Sindhi Hospital.
So you know where to head to before you begin a campaign on the sports field. Get a checkup done at the PD Hinduja Sindhi Hospital. It's always better to be safe than sorry. We wish you all the best. Thank you and enjoy the football.